Hi, my name is Martin Livingstone, AUT student. This is part of the Contemporary Intensive Paramedicine course. This is a video on adenosine and tachydysrhythmias. Adenosine is an antidysrhythmic which we use in the ambulance setting because it's indicated for SVT, moderate compromise, and also if they've got recurrent SVT, which is known to be responsive to adenosine. So we've been called to this patient who has suggested that they have SVT. So we've done a set of OBS. The OBS have come back relatively normal. So next step would be to put on an ECG. So going to do this, so we're just going to ask a little bit more about their SVT. And have you had this before? Yes, they have had this before. And what has been the treatment in the past? They've tried Valsalva maneuvers. Occasionally that does work, and there has been times where it hasn't worked and they've had to resort to adenosine in the past. So what we'll do first of all is we'll double check the rhythm, and initial thoughts are that it is a narrow complex tachycardia, which would be indicative of SVT. So we're just going to print that one out. Ideally looking for approximately 6 seconds, so we're going to have a quick look, and I would certainly suggest that there's no fibrillation in there. I would suggest that it is a narrow complex. I'm just going to ask my crew partner to verify that and what they think it is.
Yeah, confirming SVT.
SVT, cool. So confirming SVT, so we're going to try 2 Valsalvas first of all, up to 2 Valsalvas, which we've tried and they've not worked. So patient is still in SVT. So I'm going to ask them first of all, you've had adenosine in the past, and they have had adenosine in the past, so not allergic to it, no history of sick sinus syndrome, none of that. Also, have they had a previous medical history of a 2nd or a 3rd degree block, or have they had a heart transplant in the past, which again may be contraindicated in this particular procedure. Obviously there are other things that we need to ask for. Have you got a history of asthma or COPD? So no, because these can precipitate bronchospasm, and we, especially if anybody that's had recurrent bronchospasm in the past, we need to be cautious of that. With Wolff-Parkinson's-White syndrome as well, we just need to confirm that this is not necessarily a rapid atrial fibrillation, and it is an SVT, because obviously that can precipitate a VF or VF arrest ultimately. So no, we've decided that this is an SVT. So what we're going to do now is we're going to establish a IV access, which we've done earlier. So we've ideally gone for the ACF up here. And we're also going to be cautious that this procedure does cause significant bradycardia as we revert the rhythm. So we're going to be mindful of the fact that we may need to put the pads on at some stage, but we're not going to routinely do that at this stage. So without further ado, just going to set up here. So we've got IV access. Just going to put that on there. Need some medication. So we're going to go with adenosine. So pop that over there. Right, so I've got adenosine 6 milligrams in 2 mils, and it expires 12/2020, but I'll just get my colleague to verify that. Can you tell what that is, please?
Adenosine, what do we got? Adenosine 6 milligrams in 2 mils, and it expires 12/2020.
Cool. So what we're going to do is we're going to draw this one up, noting that it's nice and clear, and we're probably going to use a 5 or a 3 ml syringe. Use a 10 ml syringe in this particular instance, just in case we may have to use another ampule. So we're just going to draw this one up. Cool. Right, so got that there. 2 mils of, oh, sorry. 2 mils of solution in there. So I'm just going to recap that and discard of the adenosine. Now this time we will be warning that the patient, you've had this before. As you know, we're trying to reset your heart rate, so we're trying to bring the rapid beat that you've got going on in your heart, and we're just trying to reduce that down. May cause a little bit of bradycardia first of all, okay, and you may develop a little bit of shortness of breath as well. Don't be too worried if your heart may stop just for a short period of time, but that's only your heart naturally resetting itself, okay. May make you feel in some cases a bit lightheaded and nauseous, but that's perfectly normal. And you may get a funny feeling in your chest as well, which needs to be you may need to be made aware of. So, are you happy for me to go ahead with this procedure? Yes. So, okay. Without further ado, what we're going to do is we're going to, before we do that, we're going to draw up flush first of all. And ideally, what I'm looking for is probably around about 20 to 30 mils. So I've got a big 50 ml syringe here. So we've got 0.9% sodium chloride, and it's 1,000 mils, and it expires next February. Can you just
0.9% sodium chloride expires next February.
Lovely, thank you. So, further ado, just going to draw up some of this. Particular syringe, just get rid of the air. We've got about nearly 60 mils, and the reason that I've drawn up a little bit extra is just in case we have to repeat this process. So I'm just going to leave that one to one side. The adenosine we've got here, which we've got here ready to go. And I'm just going to mark that one adenosine, and that's 6 milligrams, 2 mils, and today is the 17th, 18th, 17th of May, and it is 10 o'clock in the morning. Cool, right. So, are you happy for me to proceed with this? Okay. And the onset of effect of this is usually about 5 to 10 seconds. It's really rapid acting, but it has a very, very short life of probably between 10 to 20 seconds. So, just going to go in here. Now we're going to put this in very, very rapidly, and then we're going to follow that up with a flush as well. We're going to put at least 20 mils in, so we're going 10, 20 mils, cool. Right, so we've gone with 20 mils, How do you feel? No different? Okay, so we're just going to have a look at that rhythm again. It should have had some effect within 5 to 10 seconds is what I say. So what we're going to do is we're just going to re-verify that rhythm. Just going to print that one out. And again, it looks to me as if it is a similar rhythm to before, an SVT. Just get you to confirm that.
Yep, SVT.
SVT. Right, so what we're going to do now is we're just going to draw up a further 2 lots of adenosine. So this one I've got adenosine 6 milligrams in 2 mil, and again 12 2020. Adenosine 6 milligrams 2 mil, 12 2020. Can you just confirm that for me, please?
Adenosine 6 milligrams in 2 mils expires 12 2020.
And this one as well.
Adenosine 6 milligrams in 2 mils expires 12 2020.
Cool. Right. So we verified that those two are the same. So again, what we're going to do is we're just going to draw those ones up. One. Good. Right. So what we're going to do now is we're just going to repeat that process. This time we're just going to double the dose because you didn't react the first time. So. Okay, you happy for me to proceed? Okay, so we're going with, this time we're going with 12 milligrams. Cool, if you can just document that. Thank you. And we're going with another 20 mils of saline. Cool, how do you feel? A little bit lightheaded? Yeah. Sorry about that, but we'll, hopefully you'll start feeling a little bit better soon. How do you feel? Good. Okay. Right. Just because of what's happened, I certainly would recommend a trip to the hospital. But as you can see, we've now appeared to have reverted back to a sinus rhythm. So I'm just going to print that one out to verify it. Lovely. How do you feel? A lot better? Good. Just verify that one for me.
Sinus rhythm rate is 65.
Wonderful. And that concludes the video. Thank you.